Diabetes is when your blood glucose, also called blood sugar, is too high. Blood glucose is the main type of sugar found in your blood and your main source of energy. What are the reasons for diabetes? Your pancreas, an organ located between your stomach and spine that helps with digestion, releases a hormone called insulin into your blood. Insulin helps your blood carry glucose to all your cells. Sometimes your body doesn't make enough insulin or the insulin doesn't work the way it should. Then the glucose stays in your blood and doesn't reach your cells. This causes your blood glucose levels to get high and can cause diabetes or prediabetes. What is prediabetes? Prediabetes is when the amount of glucose in your blood is above normal, yet not high enough to be called diabetes. With prediabetes, your chances of getting type 2 diabetes, heart disease and stroke are higher. With some weight loss and moderate physical activity, you can delay or prevent type 2 diabetes. You can even return to normal glucose levels, possibly without taking any medicines. What are the signs and symptoms of diabetes? Being very thirsty, urinating often, feeling very hungry, feeling very tired, losing weight without trying, sores that heal slowly, feelings of pins and needles in your feet, losing feeling in your feet, blurry eyesight. The only way to know if you have diabetes is to have a HbA1c test. Diagnosis of diabetes. HbA1c greater than or equal to 6.5% or random plasma glucose greater than or equal to 200 mg per deciliter in the presence of classical diabetes symptoms. What type of diabetes do you have? The three main types of diabetes are type 1, type 2, and gestational diabetes. People can develop diabetes at any age. Both women and men can develop diabetes. Type 1 diabetes, earlier known as juvenile diabetes, develops most often in young people. However, type 1 diabetes can also develop in adults. In type 1 diabetes, your body no longer makes insulin or enough insulin because the body's immune system, which normally protects you from infection by getting rid of bacteria, viruses, and other harmful substances, has attacked and destroyed the cells that make insulin. Treatment for type 1 diabetes includes aching shots, also called injections of insulin, sometimes taking oral medicines, making healthy food choices, being physically active, controlling your blood pressure levels, controlling your cholesterol levels. Type 2 diabetes, which used to be called adult-onset diabetes, can affect people at any age, even children. However, type 2 diabetes develops most often in middle-aged and older people. People who are overweight and inactive are also more likely to develop type 2 diabetes. Type 2 diabetes usually begins with insulin resistance, a condition that occurs when fat, muscle, and liver cells do not use insulin efficiently to carry glucose into the body's cells to use for energy. At first, the pancreas keeps up with the added demand by making more insulin. Over time, the pancreas doesn't make enough insulin. If your pancreas can no longer make enough insulin, you will need to treat your type 2 diabetes. Treatment for type 2 diabetes includes sometimes taking oral medicines, making healthy food choices, being physically active, controlling your blood pressure levels, controlling your cholesterol levels. Gestational diabetes can develop when a woman is pregnant. Pregnant women make hormones that can lead to insulin resistance. All women have insulin resistance late in their pregnancy. If the pancreas doesn't make enough insulin during pregnancy, a woman develops gestational diabetes. Why do you need to take care of your diabetes? Over time, diabetes can lead to serious problems with your blood vessels, heart, nerves, kidneys, mouth, eyes, and feet. These problems can lead to an amputation, which is surgery to remove a damaged toe, foot, or leg. The most serious problem caused by diabetes is heart disease. When you have diabetes, you are more than twice as likely as people without diabetes to have heart disease or a stroke. With diabetes, you may not have the usual signs or symptoms of a heart attack. The best way to take care of your health is to work with your doctor to keep your blood glucose, blood pressure, and cholesterol levels in your target range. Take care of your diabetes each day. Do 4 things each day to help your blood glucose levels stay in your target range. Follow your healthy eating plan. Be physically active. Take your medicines as prescribed. Monitor your diabetes. Foods to eat. Your healthy eating plan will include Whole grains and whole pulses, nuts and seeds, fruits and vegetables, sprouts, vitamins A, C and E, fish like salmon and mackerel. Foods to avoid: white rice and white flour, caffeine, sugary desserts, chocolates, deep-fried foods, soft drinks and sweetened fruit juices, salt. Ditch processed foods to avoid weight gain. Be physically active. People with diabetes should aim for 30 to 60 minutes of activity most days of the week. Helps you reach or stay at a healthy weight, helps insulin work better to lower your blood glucose levels, is good for your heart and lungs, gives you more energy. Take your medicines as prescribed. Your doctor may prescribe diabetes medicines that work best for you and your lifestyle. Monitor your diabetes. Checking and recording your blood glucose levels can help you monitor and manage your diabetes better. Consult your doctor for the frequency and type of tests required.